There are so many cases for sexually transmitted disease that could happen to anyone out there if they are not beware with their symptoms. For example, cases for syphilis happens when a Swiss clerk with a red patches and ulcerated nodules experience headache without systematic symptoms. Dermatologists diagnose pyoderma. Treatment with fusidic acid and oral corticosteroids didn't improve, but steroids were aborted due to adrenal insufficiency. Not at all. Example case of chlamydia is when a 19-year-old woman experienced breakthrough bleeding after discontinuing her oral contraceptive pill for 2 years. Despite not forgetting or experiencing diarrhea or vomiting, she has been with her partner for 4 months and stopped using condoms. Examination revealed healthy vulva and vagina. Last but not the least, this cases is common case that always happens in the worldwide level, AIDS case. It happened when a 21-year-old woman was treated with complaints of chronic cough, fever, drastic weight loss, chronic diarrhea, pain in swallowing, sores in the mouth, and labia majora. Chest radiology found infiltrates in both lungs. The patient had previously been treated as suffering from HIV or AIDS and pulmonary tuberculosis, or we call as TB. The patient was treated for 12 days with working diagnosis of HIV, AIDS, and pulmonary TB, as well as opportunistic infections. The patient died after being treated for 12 days.
Sexually transmitted infection, also known as STD or STI, are infections that are spread from one person to another during sexual activity. Usually, they are transferred during anal, oral, or vaginal sex. However, other forms of sexual contact involving the penis, vagina, mouth, or anus can occasionally spread them. This is due to the fact that skin-to-skin contact can transmit certain STD, such as HPV and herpes. Besides that, during or after giving birth, a pregnant person may transmit certain sexually transmitted disease to their unborn child. Sharing needles, receiving blood transfusions, and breastfeeding are 3 more ways that sexually transmitted disease can spread. STI can have serious consequences beyond the immediate impact of the infection itself. For example, mother-to-child transmission. The consequences of STI transmission from mother to child are severe and include low birth weight, preterm, sepsis, congenital deformities, stillbirth, and neonatal death. Second is hepatitis B. With its severe effects on the liver, hepatitis B is thought to have causes 820,000 deaths in 2019, mainly from hepatocellular carcinoma and cirrhosis. Moreover, condom use can help prevent STD by being used correctly and consistently. This strategy for STI prevention, which include HIV. Next, the sexually transmitted infection can be treated. This highlight how crucial prompt diagnosis and treatment are to reducing the effects of this STI.
Symptom of sexually transmitted disease. STD can manifest with various symptoms, including genital itching, pain or discomfort during urinations, unusual discharge, genital sores or ulcer, and flu-like symptoms such as fever and fatigue. However, many STD may not exhibit noticeable symptoms, making regular testing crucial for accurate diagnosis and early intervention. If you suspect an STD, it is essential to consult with a healthcare professional for a proper assessment and treatment.
There is 5 causes of sexual transmitted disease. First, sharing needle. Second, mother transfer to baby. Third, having many partners. Fourth, unsafety sexual. 5. Blood transfer.
How to prevent sexual transmitted disease? The first one is abstinence, which is the most reliable way to avoid infection is to not have sex. The second one is vaccination. Vaccines are safe, effective and recommended way to prevent hepatitis B and HPV. HPV vaccination is recommended for preteen age 11 to 26. However, some adult age 27 through 45 years old who are not already vaccinated may decide to get the HPV vaccine after speaking with their doctor about their risk for new HPV. The third one is reduce number of sex partner. Reducing your number of sex partner can decrease your risk for STD. It is still important that you and your partner get tested and that you share your test result with one another. Next is mutual monogamy. Mutual monogamy means that you agree to be sexually active with only one person. Being in a long-term mutually monogamy relationship with an uninfected partner is one of the most reliable ways to avoid STD. So the last one is use condom. Correct and consistent use of the male latex condom is highly effective in reducing STD transmission. Use a condom every time you have anal, vaginal or oral sex.